Hello, everyone. My name is Helen Barnes, and I work in the Duke Heart Center in the LVAD, Left Ventricular Assist Device Department, as a medical assistant. We have over 300 patients that are on ventricular support at Duke. What is an LVAD? A VAD is an implant that is a device that helps the heart pump blood when the heart is weakened and unable to provide enough blood flow to perfuse or supply the body. Our patients can be sent home on 3 different pumps. They are a HeartMate 2, a HeartMate 3, and a hardware pump. What I would like to do is show you a picture of these 3 pumps. These pumps, the patients are able to go home and they live on support with these different pumps. These 3 are a HeartMate 2, a hardware, and a HeartMate 3. They are continuous flow LVADs that act as a heart for patients on support. Many of the patients are discharged out in the community where people, they have caregivers that have to take care of them. And so when these patients go home, they started off, many of the patients were originally, they were implanted with the HeartMate 2 and then the hardware pump. But now they have been changed out and upgraded to the HeartMate 3. It's just like a video game. When the new games come out, the old machines don't work with the old video games, so they have to replace them. So most of the patients on the HeartMate 3 have, because of the smaller components that go with it and the less complications, they've been changed to HeartMate 3. The hardware has different components that only children can use. So many of the children are stayed on the hardware. So each pump is placed inside the heart and has a long wire that's pulled out of the stomach to attach to a computer that communicates to the heart pump. When all the patients are discharged to the community with this LVAD, they have to keep electricity power in their homes to run their batteries and to run the other components like the battery charger and the power module that controls the machine while they're asleep. Patients are also given a shower bag and different components to wear the controller so that they don't tug at their different wires and cause infections, and to have a shower bag that enables them to take a shower, because if it gets wet, the patient can get electrocuted or infected and die. So many of these patients have family members that take care of them. They have to basically be with them 24 hours to make sure if anything happens to their pump that somebody is trained and capable of running these materials. All of the patients are seen in clinic in different intervals. They are seen 2 weeks, then they turn and they are seen a month, and then they're seen 2 months to 3 months. And that's where my job comes in line, because I schedule their appointments. I make sure that they get their different wearables, and I make sure that they get their dressing supplies, because they have to wear dressing supplies, which is very costly. All their supplies are very costly. Many of the patients, they are monitored with their blood levels so that they don't have different, they can bleed to death, so they have to be monitored for their blood levels. So they have to have their INRs checked, which is an anticoagulation, to make sure that their blood clots and doesn't clot, but to make sure that it clots properly so that they can live free without bleeding to death. Also, they are between the ages of 60. We do have some that are infants for the hardware, but there are some that are between 60 and 80 years old that have been on support for more than 10 years and have been living to take care of themselves by themselves with this heart device. What they do, they are supported by their electric company is notified, the fire department, and the different communities around. They come together to make sure that these patients are taken care of in storms, power outages, and different things of that nature. They make sure that the patients get first dibs on being relocated to an area where they can be supported. My job is very interesting and I love all my patients. I have a close relationship with all of them, and I maintain all their records and everything to make sure that they're taken care of. Thank you.